Ian, Robert, hello. Thanks for joining us. I'm excited to learn a little bit more about Slimshot. How you guys doing?
Great. Thank you. Happy to
Great.
be here.
Yeah, thanks for having us.
Show us what Slimshot is and walk us through how it's different and how it works. So this is a pre-filled syringe that's got a little bit of a twist to it.
Sure. So this is Slimshot. It is a prefilled syringe that, for the same dosage of medication, is about 40% smaller than a standard prefilled syringe. The standard prefilled syringe has a plunger rod that is extended all the way out so that it has room for the medication inside, but that plunger rod takes up a bunch of space in the packaging. So, in order to save packaging space and make it more efficient and affordable to ship these syringes around, we put the plunger rod on the side of the syringe during transportation and storage, and then when you're ready to use it, you can unclip it and install it and then use it like you would any other syringe. But when it's in a medical bag or a pallet, it is compact, about 40% smaller, so that you can ship more of them to their final destination.
Okay. And the way it clips onto the syringe, that's kind of like the secret sauce with the design, correct? A
That's
little bit?
right. Yeah, it clips onto the bottom here and then is snug on both sides, so it's not going anywhere. But as soon as you're ready to use it, you can just pull it off and then do a nice quarter turn, half turn twist in order to install it.
Okay. I did want to ask a little bit about that extra step that it's going to take healthcare providers to reassemble the syringe. What have you shown this to healthcare folks? What do they think about the design? Do they still see it as a convenient package? A lot of times the pre-filled syringe does save time, but this adds to, not a lot, just a little, but what do they think of it?
We have spent a lot of time testing this with and building this with clinicians. That's a really important part of our approach and human-centered design approach. So, right, if you're making something but it doesn't work for the people who are using it, why are we making it? So we've been fortunate to work with hundreds of different clinicians over the years. We've tested it with people in their hands at different facilities and conferences and seen that it actually really works. It's quite easy and intuitive for them to understand and install. So we'll often go to a conference, we'll just hand a clinician this for the first time. We'll say, if I don't give you any sort of instructions, no packaging instructions, no verbal instructions, how would you assemble this? How would you get this ready so that you could use it on a patient? And they kind of look at it for a second, and then they take this off, look at the threads, like maybe is that it? It's like, yeah, that's absolutely it. You nailed it. It is meant to be that easy, even if you're given no supports. And it took a while. We took a number of years to figure out what that perfect design was so that it made sense to people. But now we're able to see that people, for the first time are installing it with 100%, first time success. They're installing it between 2 and 4 seconds on average, and they're able to administer medication in mock settings with success. So it's been quite a process to get there, but that's really important that we're not diminishing the clinician's experience.
You said a couple of keywords to me as you were talking. Intuitive, number one, 100% has to be not adding a lot of time, and yet it's kind of like you're giving them some benefits that they didn't used to have and asking for very little in return. That's how I look at it. I was wondering though, what does this concept work for a variety of syringe styles? Because I know there's a couple of different syringe styles out there.
Yeah, absolutely. So our goal is to make this a platform technology. So this is our 10 milliliter size, which is applicable to a wide variety of medications. We're starting off with sterile saline, but this one, for example, is a 1 milliliter long size, and it works the same way, clips on the side, and then when you're ready to use it, you just install it. Our portfolio works from 1 ml long, 3 ml, 5 ml, 10 ml, 20 ml, 50 ml. Dextrose is a big honking syringe and people want to ship that. So our goal is if you have a syringe, we would like to make it more compact, whatever the size is.
Okay, so you said you're planning on starting this with the saline, and that's one of your products. Are you also making this platform available for other pharmaceutical companies?
Yeah, so for saline, we are partnering with a saline flush manufacturer. So
Okay.
we're providing the license and the IP and doing some, supportive tech transfer work with them, and then it'll go into their product. And we're taking that similar approach with other things as well, whether it's something as commodified and common as sterile saline or sterile water, or if it's an emergency medication or a vaccine or a biologic. We're excited to work with a wide range of pharmaceutical partners and prefilled syringe manufacturers to apply it.
Talk a little bit about the regulatory process here. I know it's the pharmaceutical company that has to make sure that this is compliant, but I'm sure you've done things along the way to make it clear to potential clients that this is going to work the way it is designed to work.
Yeah, absolutely. There are three main ways that we're protecting both ourselves and the companies and the patients who we're working with. The first and most important way is that we are not changing anything about the drug contact. So the barrel, the thread insert, the plunger stopper, all of that is off the shelf, the exact same material and composition as a standard prefilled syringe. All we're doing is changing the plunger rod that pushes against that plunger stopper. So that's number one, is that we're not changing anything to do with the drug contact.
Mhm.
Number two is that we are a subcomponent designer. So to your point, the approval process would occur at the fill finish level. So if we provide the designs for this plunger rod, then the manufacturer, whether it's the pharmaceutical company or the medical device manufacturer, would use their approval process to get the drug and the combination approved. And what's nice is that the existing approvals for sterile saline, for example, can be modified with relatively low effort compared to a full approval just to get our new plunger rod on it. It's not going to be a complete overhaul of the regulatory process. But with that in mind, there are different regulatory processes for different drugs. So sterile saline is in the gray area where it's not quite an active pharmaceutical ingredient. So it can either be a 510K, which is what some companies do, or an abbreviated new drug application, which is what other companies do. But as soon as you get into emergency medicines like ketamine, epinephrine, TXA, stuff like that, then it's going to be a drug-led product, and that is going to require a drug-led approval process. So we've done a lot of legwork to figure out what those approval processes look like, and we're confident that this addition, the plunger rod on the side of the barrel, will not cause a substantial burden or hurdle that needs to be overcome.
Now, I know that there are a lot of benefits that we're going to get into, but before we get into that, I do want to talk a little bit more on the production side of things, only because I know you say nothing is different with the drug section of the syringe, but how is the packaging production line, the production and packaging line, a little different when they switch from a typical plunger prefilled syringe to the Slimshot? What needs to change on the production line?
Yeah, great question. And we've taken a lot of time to figure out how do we not require a lot of changes, because we know everything costs a lot of money. We don't want to be changing manufacturing lines. And so, yeah, if we're filling a medication in a prefilled syringe, it'll first come down the line, be filled in a barrel, and then it would be visually inspected and then labeled. All of those things stay the same. And then instead of inserting a plunger rod in the top and twisting that on, we would instead be inserting it on the side and snapping that on. So everything remains the same up until the plunger rod point, and we're doing just a side action instead of inserting the plunger rod on the top. After that, it would then be flow wrapped or wrapped in another form of secondary packaging and put in boxes. So the change is really at the far end of the manufacturing process, and it's very minimal. We don't want to get in the way and cause a lot of changing to tooling or filling machines earlier on.
Okay, and these are always with a plastic syringe?
These can be done with both plastic and glass. The 10
Okay.
ml ones we're holding here are plastic, and then this 1 ml long, for example, is a glass syringe. Our solution is material agnostic, and we actually need to have multiple material options because some of these drugs are not compatible with the materials that are compatible with, for example, sterile saline.
Okay, let's get into some of the benefits then. I know that you've already mentioned the size, with it being compact, and anyone who's in packaging can visualize the space savings, both for storage and shipping. You say about 40%, correct?
That's right.
That is a benefit to the healthcare worker, in any healthcare worker who's in a situation where space is at a premium. And there are a couple of things that you guys have flagged. Obviously, the emergency medical, I would say EMT. I had seen on your site, though, EMS. I'm not sure what EMS is.
Yeah,
Emergency medical system?
services.
Services. Okay,
Yeah,
thank
whereas
you.
an EMT is a emergency medical technician, so like an
Technician.
individual working within that system.
Okay, got it. Thanks for explaining that. And then you said like military medical kits. That makes sense because that's a lot of that is very portable. Helicopters, any place where space is tight. So I know that even in like a OR setting or a hospital setting, any healthcare setting, just from a storage point of view, they're always looking to save space. But I do see how this would be very helpful, especially for portability. But how does that small change, give us some examples of how that small change in the configuration of the syringe is going to make a difference?
We'll start with maybe saline flush, for example. For a lot of clinicians, they come in saline lock kits or saline, IV start kits. So this is bundled with a bunch of other things in a plastic bag or other sort of packaging, and then they have to put it in their kit, whether that's helicopter, disaster response kit, ambulance, a cart in the ER, whatever you have. But this is the largest and longest piece of those kits. And so a lot of people in very space constrained environments are so frustrated with the size this takes up that they do one of a couple things. Number one, they say, I'm actually just going to have an empty syringe, and then I'm going to try to source the saline from somewhere else by taking multiple additional steps, like drawing it out of an IV bag or out of a vial at the point of use, which adds steps and hassle. Or they'll say, okay, I want 10 mLs of saline, but I don't have the space for this. So instead, I'm going to get a 3 ml or maybe a 5 ml stick of saline instead, which compromises the clinical capacity we actually want in that kit. So that's not great either. Or sometimes they'll take this, and before they, go out on their shift or deployment, they'll physically disassemble it, and they'll put this plunger rod on the side, and then they'll duct tape it or rubber band it together. Or even worse, sometimes we've been told people will take a bunch of these and they'll take them all apart and they'll only keep one plunger rod for maybe 3 or maybe even 5 sticks of saline. And then they'll be assembling and disassembling this and doing all sorts of things that are not best clinical practice because, again, it's a space issue. So for a lot of folks, this is really more of a frustration than people might understand at first glance. So it's making sure that we're setting people up for success. We're not forcing them into corners where they're needing to do these weird and often dangerous DIY solutions, and they're able to carry the clinical capacity and the amount of medication and the number of medications that they want, rather than trying to say, okay, well, I'll leave this one behind and I'll only carry these things. Like, no, let's just make them smaller so you can carry everything that you want. So that's one thing. That also goes for a number of other medications. While that was an example with, it's a saline flush, the same thing happens for emergency medications or for health workers that are delivering vaccines in a, remote or low resource setting where the supply chain is really constrained and they can carry X number of refrigerated boxes to that facility that day. Well, we want to fit as many vaccines, as many health products in that one cold chain box as we possibly can, because that changes what that health worker can do in that day. So space is important for, saving money on the supply chain, being more efficient, being more sustainable, but it also really impacts what we're able to do as healthcare providers at the end of the line.
Sure, making sure that there's access to the drugs where they need. Totally makes sense. That's a good point. Can you tell me a little bit more about your backgrounds and how it is that you came up with this idea?
My background is in public health, medical logistics, and emergency medical services. So I actually started working, and I still do on the side, work as an EMT and search and rescue technician. So I always saw and used, prefilled syringes, and I saw the benefits of them. Thought they were a great idea, right? They're fast, easy, efficient. They help us provide things with lower risk to the patient and the provider, and give more accurate medications. But then when I started shifting over to working in supply chain management and medical logistics, mostly for nonprofits and governments in Africa and the Middle East and in disaster settings, I started to realize that we often didn't have access to prefilled syringes. And so I started to ask, well, why is that? And I realized it was because they're too bulky and they're too expensive. So we couldn't afford them, and we couldn't deal with the immense logistical strain that comes with bringing prefilled syringes into, contexts where it's a really long distance from point of manufacture to point of use. And so we got pushed back into, again, using, older methods that are not as good for patients and providers in some cases, such as drawing up from vials and ampules all the time. And I was like, wow, this is actually kind of a health equity issue at one point. And so I came back, and in grad school, I had some more time to dig into the issue, and I immediately realized I'm not an engineer. I'm talking about a physical product. I need help. And so Robert and I have actually known each other since undergrad. And he's the most creative engineer I've ever met. And I called him up and tried to pitch him on a couple things, and thankfully he said yes. But I'll pass it over to him for more of his background and how we ended up here.
Nice,
Yeah,
thanks, Ian. Yeah, Robert, tell us.
Yeah, so I've been doing mechanical engineering for my career, and I fell in love with human-centered design in undergrad. And when Ian approached me, like he said, he had a ton of ideas for how to help his public health work. And some of the ideas, I don't think I can prototype that in my garage. And then he showed me this syringe and was like, this plunger rod is taking up too much space. How can we get rid of it? And now that was something that I could sink my teeth into. And what's fun about this particular design challenge is it's a really simple thing. I can hold it in my hand, but 7 to 10 billion prefilled syringes are used every year. So it's an immense opportunity to innovate, even though it's something that I can just hold in the palm of my hand. So I got to work on brainstorming, and 3.5 years later, we've got something that we really truly believe can make a big impact. But yeah, I'm glad he
Well,
gave me that call.
yeah, I don't think you guys are the only ones who think this is going to make an impact, because Slimshot has already won a design award, the Red Dot Design Award, for the medical devices and technology concept category. Can you tell us a little bit about this competition and why winning this award has been significant?
It's been amazing, first of all, to receive that recognition. And the red dot is something that has been recognized internationally for more than 20 years now, I think. And typically it's larger companies that are coming up with these big world-changing ideas. And whether it's there's actually some concepts that have been in this prefilled syringe world. One of our friends has a dual chamber prefilled syringe that won a Red Dot Award recently. Gerresheimer won a Red Dot Award for an innovative vial-based auto injector concept that they're working on right now. An old company of mine actually recently won a Red Dot Award for their cold shipper, which is a cold storage box that has intelligent tracking. And it's amazing to be a part of that group and to receive that validation that this thing that we're making really has a chance to make a difference. And there's something to be said about getting external validation, because we're still the same folks who are making this design, but we've gotten a lot of other people knocking on our door now that we've received that award. And so I don't want to downplay the significance of that, because we've really had some doors open because of it, and we're very grateful to be recognized.
Wonderful. Well, congratulations on that. It is
Thank you.
an honor. I did want to go back and ask you a question. One of you had brought up the idea of expense, and it reminded me to ask, is there how does this compare cost-wise to a typical prefilled syringe?
We use the same amount of plastic for our plunger rod as a typical plunger rod, though we're actually working on some designs to reduce that even further. So the amount of plastic and the cost of molding that plastic is the same. And of course, there are upfront costs to change any manufacturing line or launch any new product. But at scale, what's really exciting is we end up saving a lot of money in terms of supply chain savings. So that's because we require less secondary packaging, less flow wrap or less cardboard per unit shipped. So you save money there. You also save a lot of waste and carbon as well. And then if you're terminally sterilizing something, a lot of sterilization is priced by volume. So if we're able to sterilize more syringes per box or volume, then we're reducing that cost as well. The same goes with shipping, storage, especially when it comes to cold chain storage. And then in the case of a product not being used, if it's destroyed, that's often partially priced by volume as well. So we're able to save at all of those different supply chain steps, and we've calculated that to be up to 35% of supply chain savings. It has the potential to be unlocked with this simple design change. And that's exciting because that reduces cost, and that also has the potential to increase access.
Okay, I understand the cost savings, which is significant, quite significant, but just it does cost a little bit more, this design versus the typical syringe.
So the cost is going to depend on a lot of factors. When we are
Okay,
first starting out, yes, it is going to cost a little bit more. The
okay.
reason for that is because we are not at scale. If for a 10 ml saline flush, for example,
Hmm.
billions of these are made every year. And the cost savings that we get by making it smaller when you're at 1 billion units per year is offset by the fact that you're making 1 billion of them. So when we're starting out with these 10 ml saline flushes, we're going to try to make 4 or 5 million per year. And the savings that we get from the packaging reduction will not be as great as if we were making, a billion of these. But
Okay.
the more units we're able to produce, the lower our fixed costs will become relative to the number of units that we're shipping. And then as we get the unit numbers higher, the savings we get from the packaging will be able to catch up to the initial investment that we had to make to get this off the ground. So the short answer is right now it'll be more expensive, but eventually it'll get cheaper, and it'll get cheaper than the existing prefilled syringes.
Plus all the savings that you've already outlined.
Exactly.
Okay, got it. Thank you for that. Could I ask where the manufacturing facility is for the syringes? Slimshot?
Yes. Yeah, so we don't manufacture our plunger rod ourselves. We do prototyping, and then we partner with companies that bring it in-house or use their own CDMO to make that. So the groups that we're working to license to will decide where the plunger rod component is manufactured based on where they're doing their work and their assembly. So that is not finalized, and there's not like one spot where all of them will come from.
Yeah.
Okay.
Certain examples include the United States, Canada, Europe. These regions where global prefilled syringe manufacturing occurs is where we'll be doing our manufacturing as well.
Okay, excellent. And you mentioned saline already as a target product. Do you have a partner for that already that you are able to identify?
We are not able to share it, but we're very excited to be able to share that soon, and maybe that can be another press release. But
Okay.
we do have a target partner, and we're very excited about it.
Okay, excellent. Well, again, congratulations for that.
Thank you.
Ian, Robert, is there anything else that I haven't thought to ask about Slimshot that you'd like to share with us?
I think first and foremost, we are excited about impact. A lot of people ask us why we started this company, and truly the goal is to make prefilled syringes more affordable and more accessible. And we are not able to do that on our own. We have gotten a lot of success and momentum by these partnerships that we've been describing so far, and we are very open to others. And those partnerships can range from individual startups who are similar size to us, or to some of the world's largest multinational corporations. We've been having conversations with all of them, and together we believe that we can make a really big impact. So if compact prefilled syringes resonates with you, regardless of your size or your scope, we would love to talk. And there's room.
Okay. Well, all I can say is if you do get a drug company interested, that will make it a million times easier to find a manufacturer to license it. So
Absolutely.
yeah.
We've got some folks who are knocking on our doors, and we're taking phone calls, and we're very excited to share names in the near future. But for right now, there's some paperwork that's been signed, and we gotta stick to it.
Understood. Okay. Well, thank you
Thanks
guys.
so
Appreciate your
much.
time.
Yeah, thanks a lot. It
Thank
was a
you.
pleasure talking to you.